where the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.
Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese. Great to have you here today. For those of you that have been without power, I hope you got your power back because I was one of those affected by it, and I'm mighty glad to have electricity running. If you're new to the show, be sure to like and subscribe. That always helps our algorithm. But enough said about that. Today on UroNurse, we're introducing a groundbreaking new approach to urologic care, urologyhealth.com, the first virtual urology practice. And joining me is Dr. Diane Newman, Chief Clinical Officer, and Dr. Stuart Hart, Founder and CEO. Now, we've had Diane on the show before. Diane's always been a great friend for years. So Diane is nationally recognized as an expert in urologic nursing, urinary incontinence, and bladder health. With decades of clinical research, education, and patient care experience, Diane brings a strong focus on improving outcomes and empowering patients through better access to urologic care. Stuart Hart brings a unique combination of clinical medicine, healthcare, leadership, business, and technology to the development of this innovative virtual urology practice. Together, they're going to explain how urologyhealth.com is bringing expert urologic care and trusted medical expertise directly to the patient, virtually, conveniently, and wherever they are. So, welcome, Diane and Stuart. Welcome to the show.
Thanks so much, Vic. Yeah, thanks so much, Vic. And as I've been on this show several times, and I have to tell you, Vic, it's exciting to be able to present this to you.
Yeah, I was excited when I heard about it for the first time. I'm like, oh, I got to get Diane on. This is something I love to share with people. So I'm going to go right to the presentation and let you talk about it, and then we'll come back for some questions.
Thanks, Vic. Yeah, Stuart Hart kind of approached me, I don't know, now what is it, Stuart, about a year and a half ago?
Yeah, about it, yeah.
And with the idea of providing treatment for a lot of conditions in urology that really are not being addressed. I like to refer to them as functional urology. And we put together Urology Health, which is a telehealth program, a virtual program. We're starting with urinary incontinence and overactive bladder, but let me give you some information. You know, when you look at urinary symptoms, they really have a significant impact on the economy as far as cost, but also clinical impact. And you can see the billions of dollars that the healthcare system is spending on urinary disease. And they're associated with a lot of comorbidities such as falls, and it impacts the patient's quality of life. So how are we going to approach this? Because as we're seeing in practice, I don't know what you find out there, but it's very difficult to get in to see urology. I'm on with many of my colleagues who are telling me sometimes it's 8 months to get an appointment because they're so backlogged in appointments and patients. And we look at urology, of course, it includes all the cancers such as, bladder, kidney, prostate cancer, but there's a lot of what I call functional urologic conditions that people live with sometimes throughout their entire lives. Incontinence, overactive bladder, urinary tract infections, especially in women, interstitial cystitis, pelvic pain, BPH in men. Now prostate cancer screening is changing. How is that going to be managed? And then chronic prostatitis. So these conditions, I feel, and I've been in urology since 1986, are really not well managed. And so patients are really struggling to access care, even though there's good treatment plans that have research behind them, that have evidence. The problem is some of these treatments take some time. And as a healthcare provider, and I'm sure Stuart will, kind of chime in here, it's very difficult to spend the time with some patients with some of these conditions. So we first decided that we were going to start with kind of what I consider the top conditions, overactive bladder, urinary incontinence, because they affect so many individuals, men and women, across the lifespan. And when you look at the model, I've done behavioral treatments my entire career. Stuart is a surgeon. I mean, you as a urogynecologist treat these patients for years, right, Stuart?
Yeah, absolutely. And you look at the numbers, they're just astounding. And how many patients, how many men and women in the U.S. have these conditions and don't know that treatment is available or are unable, to get treatment. I think, Diane, when you look at the numbers here, half of Americans with urinary incontinence were never evaluated or even treated, and a third of patients diagnosed with overactive bladder, only a third received treatment. But I think that the last one, how long women and men wait for treatment. For women, it's over 6 years from the time they develop symptoms to the time they get treatment, and for all the reasons that you see here on this slide.
Yeah, and I think that the model of urology and even urogynecology is based on surgical care. But a lot of these conditions, yes, surgery may be part of the treatment algorithm, but we can start with some what we call non-invasive treatments that can really work for men and women that have evidence behind them, but they do require sometimes more time with that provider to explain what they are, and also encouragement in following that patient. And I'm not sure currently the model in urology is going to really meet these needs of these patients. And I think that's really what pushed us to try to do it a different way, right? Provide practice in a different way. And telehealth, virtual, care is really becoming more and more common. Don't you say so, Stuart?
Yeah, I mean, without a doubt. I mean, the whole idea that we really created was about how do we provide accessible care. When you look in the United States, and we'll go into some of the statistics, we have a huge shortage of urologists and urogynecologists. There's very few of us in the country. So how do we provide the accessibility that is needed to manage really the large number of these patients out there? But at the same time, how do we increase engagement? Like you were saying, you could wait 6+ months to see a specialist, and that's not acceptable for patients that are really struggling with these conditions. So how do we give them accessibility to care, but then how do we engage those patients and provide them with the treatment they need, but be able to see them very quickly if they have any challenges along the way during their treatment. And the other is cost.
Mhm.
It's so expensive, as the last slide showed. I mean, urologic care is, it kind of ranges, but in that last study in JAMA, it was the sixth most expensive health condition in the United States. So how do we provide more cost effective care to these patients? And we know with an aging population, the number of patients with both men and women with these conditions is only increasing. So it's going to be really important that we provide cost effective care.
And when we look at incontinence and overactive bladder, I think one of the reasons why women especially don't come forward is the embarrassment and around this condition. And I really saw during COVID, when I was doing telehealth visits, that that was really the model that really worked with these conditions. I could talk with them in their home, go over the medications they're taking. I would see what the bathroom location was. So telehealth is a good model of care, I think, for some of these chronic urologic conditions. And as Stuart says, especially in rural areas, there's really a shortage of urologists and urogynecologists. You know, urologists, the age group of urologists in this country is really near retirement. So we have more urologists retiring than entering the field. We don't have them in many parts, especially in the rural counties in this country. However, with the aging population, urologic diseases are only increasing. So, the dilemma is, where are the providers for an increasing population of individuals who need them? And I think that's really a tsunami that we're seeing in this area of healthcare. And I think with urogynecologists, it's the same thing, right, Stuart? That we're saying
Yeah.
that.
Yeah, I found that this number astounding to me, that more than 60% of all counties in the United States don't have a urologist. And then, even more so in urogynecology, it was over 98% of zip codes in the United States do not have urogynecologists. In fact, 45% of hospital referral regions don't have urogynecologists within 50 miles. So we have a tremendous shortage of specialists to manage this population that's just increasing over time.
So, when we look at the field, especially in the area of incontinence and erected bladder, we have evidence. And as someone who has provided behavioral therapy for my entire career, it's been somewhat frustrating to me that I've seen more and more urologists turn away from this type of treatment. It does require someone knowledgeable about how to, teach bladder training, how to go over someone's diet to see where we have irritants that may be affecting the bladder. But the first line treatment is what we call conservative behavioral treatment, and it has evidence to show that it can be effective in women and in men. And then, depending on how symptoms are, we can add on second line treatment, which is drug therapy. And the combination has been shown of behavioral and drug therapy to be very, very effective. And then that way, if that individual, if you don't see the success that you want, we do have third line treatment, which may be surgical interventions. So we have the evidence. And the question is, how are we going to get that out to people that need them? And that's really what urology health is really focused on at this point, providing that evidence-based treatment options to individuals who have these conditions.
Yeah, exactly. And I just kind of reiterate that it's really all about providing first and second line therapy for these conditions, these lower urinary tract symptoms, with patients with lower urinary tract symptoms. How can we provide them with that first and second line therapy, and then get them referred into the healthcare system appropriately when they do need third line therapy or surgical intervention?
And there's some research that I've done that telephone counseling has been effective in decreasing these urinary symptoms. Some of my research that I've published is with bladder health classes that where we went out. We actually, one of the ones is bladder fitness after 60, that we really actually brought in a group mostly with women over the age of 55, and we taught them these behavioral therapies, and we showed that this type of, this type of practice can decrease these symptoms. But what you're finding is that there's kind of no way in medical care, right, Stuart, to place that. How do we provide that? Because if our class was an hour long, you're never going to get that in a practice, in a visit with a provider. I'm sorry, no matter what condition you have, you're not going to. But we have shown that to be effective. And how do you deliver that? So what is the delivery of care? And we feel that with Urology Health that we have really kind of created that model for care. So when you look at, I'm going to have you do this, Stuart,
Sure.
explain what that platform is that we've really developed for patients.
Yeah, the idea is exactly what Diane was saying. How do we deliver the appropriate care to the patient, and especially in the current healthcare system, it's so constrained. You go to a specialist, they may have 10, 15 minutes with you. I think if you even got more than 20 minutes, you're very fortunate. And it's because of the shortage of providers and the way the healthcare system is designed. It's all about volume of patients. So, no specialist has time to sit down with a patient for 1 to 2 hours or even multiple hours and really go through what is required for first line therapy and all the different nuances of second line therapy. And then when you start to look at all the various treatment options that are available, there's just not enough time in the day for a specialist to go through all of these various treatment options. And that's really kind of the impetus behind Urology Health is we can not only, use digital technology to be able to educate the patient on all the various aspects of conservative based treatment, medical treatment, but then be able to also manage in a very cost effective way all the various non-surgical treatment and everything from nutritional counseling to cognitive behavioral therapy. You would struggle to find any, I think, specialist in urology or urogynecology to be able to provide cognitive behavioral therapy. You're just not going to find it anywhere. So, and that has to be specifically designed for urinary symptoms. But Also, there's all these new pelvic health devices that are coming out, and how do we plug into those, and how do we utilize those? Because more and more patients want at-home care, and how do we utilize that? How do we collect the data? How do we interpret the data and then provide feedback to that patient so they can continue to improve? There's also a huge amount of data that's out there that will help drive the types of therapies they'll get, and if they do advance to second line therapy. And even now, I mean, you have transcutaneous tibial nerve stimulation, which you could do at home, but who's monitoring that? In addition to that, there's all these newer digital health solutions that are at home that can do everything from scanning your urine to figuring out whether you have, recurrent UTIs or at home Euroflows, and to figure out if a patient is voiding correctly or they're obstructed. And how do you pull all this enormous amounts of data, all these various treatment options together? And that's why we created Urology Health, is to create the platform that allows us to pull all this information together, to evaluate this information, but then provide the telehealth behind it to be able to guide these patients, but in a way that we plug into the healthcare system. We're not competing with the current brick and mortar primary care doctors or urologists or gynecologists. Our goal is to augment them, is to sit kind of in between primary care and the specialists, be able to help manage these patients. But we know that there are patients that need to be referred on to surgical or procedural based therapies. And how do we do that? How do we get the right patient to the specialist when they need that treatment? But then how do we manage all these other things that currently are not really being managed, at least not effectively, in the current healthcare system? How do we manage that through digital health? And that's what we've spent the last, over a year and a half building, is this digital health infrastructure to be able to manage very comprehensively these patients, and at the same time educate these patients. So it's not just treating them, but it's educating them along the way, so they're part of that journey. We bring them along in the journey. So because it's a partnership with the patient, and it's we want them to understand their condition, understand what the treatment options that are available, and then be part of that decision making. And that's really, as you can see here, the power of Urology Health and why we developed the platform.
Yeah, and one of the things that, everything that you see on this, like Stuart brought up the pelvic health devices. Patients and men and women are bombarded, if you're ever on social media, with the new device. It's going to help you, get your bladder back in shape, get your bladder back in control. But I think that, you need someone to really look at your problem and say, this is going to be the best for you, or to guide you through that treatment process. And one of the things that we're really excited about is that we're going to be able to, we're starting with women with urinary incontinence and overactive bladder, but our goal is to really get to women early. The data shows that 1 out of 3 women after childbirth, after delivering a baby, have what we call stress incontinence. They're young, although they're premenopausal women who maybe only have episodic urine leakage, maybe when they lift the baby or maybe when they go out and exercise. We feel that, and the data shows that behavioral training can help them. And the goal is to maybe start at that point before you get to, I don't know, 70 or 80, then all of a sudden you have more and more urinary symptoms. So we really think that we're offering something that actually isn't really being offered in practice to certain populations that really could benefit from this type of interventions. And this is really the platform. And I know this is a busy slide, but Stuart, I'm going to have you walk through this, because we have kind of like 2 arms to our platform as far as coming into it and going through the program.
Yeah, I think it's a great point. The 2 arms of the platform are essentially, we offer conservative-based treatment programs, and then we offer more of the kind of traditional medical treatment, but it's all incorporated into one platform. So if you see a provider on Urology Health and you have urinary incontinence, overactive bladder, you're always offered first-line conservative-based treatment. And so for that, we built a 12-week digital therapeutic program for women with urinary incontinence and overactive bladder. We'll be doing the same on the male side as well. So we incorporate a full educational program around first line conservative based treatment, even if a patient goes right to second line treatment or has had second line treatment. So we take a very holistic approach to the patient to make sure that they have all the treatment options available to them, and through shared decision making, we make the best treatment decisions for that patient.
Yeah, and we have factored in here validated questionnaires asking you about your urinary symptoms, and we track your symptoms over that 12-week period. We're going to ask something called self-efficacy. Do you think you can do it? We also have factored in adherence. By week 9, we ask individuals, are you doing the different behavioral treatments that you have learned and you've been taught? So we really have a very robust program. Again, I want to stress this is based on other successful research showing that this is effective, but we're the first one to do it this comprehensively and making it online. You can do this on your computer, the program, you can do it on your phone, you can do it on your iPad. So it's really, care in the privacy of your home. And I think that that's one of the huge benefits of this. And then, of course, I think, is really helping us make this even more effective and more successful. And what we want to do is just show you one of the screens of the program, because there's a lot of really important things that we have put into the program. And Stuart, how about you go through, and I kind of highlighted some of the areas that are really the key to the underpinnings of this program.
Yeah, we really spent a long time thinking through the patient journey, and how do we educate the patients? How do we bring that patient along in the journey as we go through various different treatment options that are available? And the other thing I'll reiterate is what Diane mentioned on the last slide, is about we're very data driven. We're a very data driven organization, very evidence based organization. So it's all about the data. It's all about using validated questionnaires to track patients objectively. Too often we're treating patients very subjectively, just in how they've done over the last few weeks, but not over the long term. And so one of the first things we did is, as we built the educational module, the training modules, and as you'll see, each of the weeks has various education behind various bladder health conditions, and it goes into, we create summary documents to simplify it for our patients. But we wanted patients to visualize their progress. And so what we did was we created a very unique dashboard that not only tracks overall their symptoms, but it also tracks each individual symptom. So urinary urgency, urinary frequency, nocturia. So certainly over the 12 weeks of the what we call the bladder health program, which is the conservative based treatment program, but well beyond that, as long as the patient is receiving care from Urology Health, we're tracking those symptoms. And so patients have access to this. All they have to do is go to the progress bar on the left side, and they can see their progress. They can see over time, as their urinary incontinence symptoms, their frequency, urgency, nocturia, has it improved? Has it gotten worse? Has it stayed the same? And so we break all these down using validated questionnaires that have been scientifically proven. But in addition, we've also, again, getting back to the holistic idea of how do you take care of that patient, it's more than just around the bladder and urinary symptoms. We know that the central nervous system has a large impact on your bladder symptoms. And there's increasing evidence that using techniques like cognitive behavioral therapy or meditation or deep breathing, and if it's done correctly, it can significantly help, especially with those overactive bladder symptoms, chronic pelvic pain, interstitial cystitis, those type of symptoms. And so we actually built that into the Urology Health digital application. And so patients have full access to this. So we encourage them to go through meditation modules that are customized using AI to that patient. Deep breathing exercises, how to breathe effectively. We developed a cognitive behavioral therapy module specifically for urinary incontinence, really the first of its kind, really leveraging digital health technologies. And then Diane, I'll let you go into the yoga program, which
Yeah,
is
yeah,
fascinating.
yeah. It's really is fascinating. As we said, our program is based on the evidence that has been funded actually by NIH over years to be effective. And there's some initial data about the use of yoga to help improve pelvic floor health and to decrease urinary symptoms. And I know a lot of women are into yoga, even men. My daughter, before she delivered, she did yoga throughout her pregnancy. She felt that the yoga helped her delivery of my granddaughter. And so we went to a researcher at the University of California in San Francisco who had done some preliminary work. And based on her protocol, her physical therapist really developed 12 weeks of yoga. There's no program that has this. And, so that is really an option for someone who may be into that or wants to start it. But she explains what's going on in the pelvic floor, how you can use that pelvic floor to possibly strengthen it or prevent the leakage. But there's also, like Stuart says, cognitive behavioral therapy. We know that that does help. It helps in other conditions such as like irritable bowel syndrome. And someone, again, out of California has created a specific CBT, cognitive behavioral therapy program for us. We call it talk therapy, but also meditation, how to breathe, how to handle your urinary urgency so you're not rushing to the bathroom and possibly leaking. So this is really a robust program as far as providing you with the information to help you really succeed and regain that bladder control. We also have a large language model. So that little thing down at the bottom there, My Bladder Expert. Stuart, explain that, because I think that is also very, very unique. And a lot
Yeah.
of people don't understand what that is. What is that going to do for individuals who come into our program?
Yeah, now so many people are using ChatGPT and various LLMs to learn information about their disease condition, and they're good, but they can hallucinate. So we wanted to ensure that our patients had access to an LLM that was specifically designed around urologic conditions. And so we worked with a group of experts in this space to develop our own LLM that was populated with scientific evidence that is rigorous and that is peer reviewed, and that would give patients the information that they need without the worry of hallucination. And so we spent a lot of time, and we didn't have to do any of this. We could have just relied on ChatGPT or any of these other LLMs. We wanted to have our own, but what makes us so unique is not only the ability to um, have a specific LLM, but it'll capture what the patient's concerns are and alert the provider. So then when they follow up with the provider can then answer in more detail their question. So it's a fully integrated system. And then I want to bring up one more thing that Diane brought up. It's not just about the education. While we're educating them, we're actually integrating the techniques that they need to help overcome their urinary symptoms. We go through, everything from, fluid intake to how to overcome bladder urges to properly doing pelvic floor exercises or Kegel exercises to the technique called the knack to help with, if you have more stress incontinence. So we integrate that into the teaching over the 12 weeks is not only do we educate the patient on the condition, their anatomy, the treatment that they're being provided, but also various conservative based techniques that they can do at home on their own, and they should be doing every day to kind of reinforce the conservative treatments that are being discussed with them.
Yeah, and on the medical arm of our program, the person will talk with a provider, so they will see a provider, and I think that's important. And the other thing is the entire program is hooked into electronic health record, so we will have notes on this that we will share with, say, the referring physician or your primary care physician. We will send referral notes back with a really detailed history of what that individual's symptoms are, but also what they have done as far as with the behavioral therapy. So it's all integrated, similar to what you would have if you went to a brick and mortar office to see someone. So that is all in this program. So it's a very, very robust program that we feel that is really going to make an impact, starting with urinary incontinence and overactive bladder. But like I said, we're going to move on to other what we call the functional conditions, urinary tract infections. I've been in urology since the 80s, and I know Stuart will concur with this. We don't really want to see a lot of urinary tract infections. And it's the number one reason why women go see a provider is because of infections. So we're going to be able to offer that. Those that have recurrent infections, those that have interstitial cystitis, again, they go from provider to provider to provider to seek out care, where the evidence shows that, hey, some of behavioral changes can really help for someone who has IC, interstitial cystitis. So it's a very, very robust program, and we're just starting, and we're going to grow into all these other areas that we think are really needed.
And Diane, I think you really described this the best, that there's such a big need for a almost a new specialty of medical urology. Urology is truly a surgical specialty, and urologists or gynecologists, we spend much, if not most of our time in the operating room. We just don't have a lot of time to manage the medical side of urology. And it really deserves to be almost a specialty that sits between primary care and the surgical urologist. And really that's the niche that we're filling is, we're trying to create that medical urology specialty, and we're doing it using digital health because it doesn't exist as a true specialty.
Yeah, Stuart, you bring up something I always used to say that, individuals, patients, or even other colleagues would say, well, what are you doing in urology? And I would always say, well, I'm doing everything but surgery. And you're right that there's so many other conditions that not necessarily require that invasive type of procedure, that conditions that people live with their whole lives sometimes. Like look at men with enlarged prostates for BPH and that. That's not something that's going to go away in a year or so, but it can be well managed with non-surgical intervention. So I think that we're providing something to the field that right now is not really being provided. So we're really partners with the urology specialists, the urogynecologist specialists. And I think that we're really helping the primary care provider who is looking for something like this to help with these patients. I think a lot of times they ignore it. They don't ask about, are you having problems with your bladder? Do you ever leak any urine when you laugh, cough, and sneeze? Because they're not sure what to do with it. So I think this is really answering a niche in care that right now is not being managed. So what we have here is we have our link. So please put up your phone and you can go right to Urology Health and, sign up. We really thank Vic for having us here because we're so excited about this. And I really hope that you come. This is really an evidence-based program that can be successful. It's going to be provided in the privacy of your home or wherever you're going to access it. But we just know that we're going to help lots of people.
Hey, that was really great. So I did put the link up here in the corner so that people can see that and follow that through. Let's see if I can get us into our 3-man person. There we go. Great information. I'm going to bring in some comment I did see come in. You were talking about yoga, and Katie Bortel put down, I've been doing yoga for 12 years, and the Urogyne said my pelvic floor muscles are as if I had no leakage. So yoga works.
Yeah, that's why we did it, because I would have, and I know this is anecdotally because there's not a lot of solid evidence, but it is being studied. But patients, old and younger women, would come in and say to me, oh, yoga, I think I'm getting better. And I think that's what's helping me. So I'm not surprised by that comment.
Yeah. So walk me through a little bit. Is that a patient coming on board? They check out the website. What happens?
Yeah, they can go ahead and sign up. We have 2 different entries into the portal. One is if a potential patient, male or female, wants to see a telehealth provider. All they have to do is go in. They can put their insurance information in. It'll find their insurance, figure out what their copay is, and schedule an appointment. As soon as that appointment is scheduled, it also opens up the 12-week program. So full
Mhm.
access to the 12-week program, the yoga, cognitive behavioral therapy, all the various tools that we discussed are part of that patient's treatment plan.
Mm-hmm.
And that was designed to on purpose to really help the patient be treated from a holistic viewpoint, not just it's not just about the bladder when you have urinary symptoms. It's really about the whole body. And so we wanted to ensure that every patient has access to full conservative based treatment in addition to if they need any other treatment. But there's also an option if a patient doesn't want to see a provider, or maybe they already are seeing a provider and they just want additional care, they can go in and sign up for the 12-week program and go through the 12-week program and use all the tools that are part of that program.
So,
Great.
there's really an option they can do it themselves or really see a provider, Vic. And the providers right now, we're using advanced practice providers, nurse practitioners, and PAs in states. Vic, I haven't sent out a notice yet, but I can't tell you how many of our colleagues have asked me as far as, Diane, what you're doing, I'd like to do it in my state. We're going to sign someone up who actually is in West Virginia. We have an individual, Jen Sarah, who you may know. I mean, she's involved with Soon in that, who's going to start seeing patients in Nebraska. So, and they will all be trained in this field. Some already have urologic or women's health background, but these are going to be really knowledgeable individuals who will be able to go through, see the progress of the patient, help them with, hey, you're having this problem. How about you try this? And then, like we said, if behavioral doesn't work, adding on drug therapy, they can prescribe in that. And then at the end, if the patient still hasn't met their goals, or maybe they're 50% improved, but they want to get even better improvement, we're going to refer them back into urology and urogynecology for third line treatment.
Yeah.
Diane, you bring up a great point that all the providers have expertise in urology and women's health. I mean, that's, depending on if it's a woman or a male patient coming in. But in addition to that expertise, because those are the only providers that we bring on or who have that expertise, we do additional training. And Diane has created an entire training program to ensure that everyone is treated to the standard of care. I mean, that was really important to us when we started this, is that every patient is treated to the standard of care, or at least offered the standard of care treatment. In fact, on the back end, what we didn't discuss is we've built a clinical decision support tool for the providers as they're seeing the patients that alert that provider to these are the recommended treatments for these patient symptoms, for what they've tried in the past, and it gives recommendations on what they should consider moving forward. So we built in the background a lot of the digital health infrastructure is pretty impressive. But in addition to all that, Diane is from her vast experience and years of clinical studies and teaching all over the world. She's really built a very robust program that every one of our providers goes through in order to become a provider on our platform.
Yeah. So that's a good point. I live out in the country now, so the access to find care in urology may be limited for people. But if I wanted to find the expert, that's going to be almost impossible without traveling, and trying to find a Diane Newman and who's got time to see me, right? Both of those combinations. So now, what geography do you guys cover? I mean, the whole U.S. I mean, this show goes out worldwide, by the way. So.
Our pilot is ongoing right now in the state of Florida and Pennsylvania.
Okay.
We'll very soon be through the pilot phase, and then we go through our launch phase where we have our next 30 states all lined up, which in the next 3 to 6 months we'll be in. Our goal is to be in all 50 states within the next 2 years.
Yeah.
So
yeah, I think that's
very
huge.
rapid expansion, and we'll have nationwide coverage throughout the U.S. Within that 2-year period of time.
And we're also teaming up with insurers, Vic, so that individuals and Medicare will have in that, so that of course we'll be able to use their insurance as far as for payment and that. And it's very reasonable. And it's like I said, the telehealth model is out there, and we've been doing it now for how many years? I have to tell you, I'm getting into this. Talking with other individuals and possible partners, I cannot. I was so shocked by the number of online virtual telehealth programs for urinary tract infections. And there's a lot of new things going on with that, with the urobiome, as far as sending urines and
Yeah.
that. So, and retail practices are inundated with these individuals, especially women, and they're not sure what to do with them. I know that when I was at Penn, I tried to, and I'm still at Penn with research, but when I was really actively seeing patients there, I wanted to start a urinary tract infection clinic out in our suburbs of Philadelphia. They weren't interested in that. But I had so
Yeah.
many retail practices calling me and saying, "Can I refer patients to you? I don't know what to do with this patient and that." So there's such a need out there for many of these conditions. And I hate to say many of these conditions in women. We know about the big advancement now with the FDA approving estrogen, taking off the black box for the estrogen products. Women are
Mhm.
really searching, and we
Yeah.
feel that we are really, really answering a need that's out there that has not been met.
Hey,
Yeah.
you bring
And
up a great
mhm.
point about urinary tract infection. So often we're using very old tools, very old technology, like typical urine culture. And that misses a lot of the causes in especially women who have chronic urinary tract infections, recurrent urinary tract infections. And it can sometimes be very challenging to find a specialist who not only wants to treat recurrent urinary tract infections, but also is using the latest technology. And that's one of the other problems we wanted to solve with urology health is we want to use the latest in diagnostics, and that's exactly what we do. We use urobiome testing. We
Mhm.
use more advanced urinary tract screening techniques, and instead of using traditional urine culture, we use more advanced techniques because unfortunately, so many times in a patient with recurrent urinary tract infection, they go from clinician to clinician, provider to provider, and they can never find the care. And it's actually sitting right in front of, it's sitting right there, the
Yeah.
cause of this. And so using the right diagnostics, we can figure out what the problem is and then treat it more effectively and hopefully reduce antibiotic overuse, get
Yes.
them treated, get them back to living, a very, much more normal life,
Mhm.
a higher quality of life than they've been living.
Well, and as you pointed out, the access to care. So what does a woman with a UTI typically do? They go to urgent care.
Mhm.
Right.
Urgent care is a in and out type place. Here's your script. Go ahead and not to knock urgent care. They have a point, but they're mostly going to just treat them with an antibiotic and hope they hit the right one and maybe
Yep.
get a culture and
Mhm.
order. But as urology, as we've been involved in, Diane and I can both speak to this, being in urology for a number of years. Um, we suddenly found that, wait a second, some of these women don't need antibiotics; they need estrogen.
Right.
And we would take these chronic UTI patients, estrogenize them, and all of a sudden you don't see them anymore.
Right.
That monthly visit's gone because that's what they needed. But they're not finding the experts out there to get that type of treatment. So it sounds like your system would be one that they could feed into to get that right expert advice.
Yeah,
Yeah.
absolutely, or it could be fluid. They're not getting enough
Mm.
fluid, and these one-off treatments with antibiotics, it may be absolutely appropriate for the right patient if it's they've had one UTI and they haven't had a second one. But once you have a second UTI in a short period of time, then it requires more
Yeah.
advanced testing and really requires that you seek more specialized care, and that's what we're offering.
Yeah, and we're partnering with a lot of different groups. Like there's a group out there just in the area of UTI that's tracking according to what the pH of the urine is, so that women can start. Like I don't know, you track your menstrual cycle. If you're someone who's apt to have more, have a history of urinary tract infections, have multiple infections in a year, like Stuart said, we'll be able to track what's going on with that urine. So maybe we can preempt a new infection type of thing by maybe increasing fluids or some of the antiseptics that are out there that might be helpful. So you're right. We really have really developed, a state of the art program utilizing a lot of resources that are out there, partnering with them, but also again providing the convenience of seeing a
Mhm.
provider with the telehealth model.
And the labs, you don't necessarily have to go
No.
into a lab provider. We can send the labs to your home.
Mhm.
Yeah, and nowadays convenience is definitely there because we're in the DoorDash generation. They
Yeah.
don't want to get out and do anything for themselves. They want it sent to their house, and which isn't so bad.
Mhm.
Um, so now all this data that you're collecting too is the AI able to crank through it and try to find things that we might be missing when we get larger populations to study. I know Diane's always studying everything and with urology. So what do you think is going to happen as far as research goes?
Well, that's
For the
actually what
data.
I'm really excited about especially with AI. We're going to have data. We're going to have data on who came to the program, how long they were in the program, what their symptoms were. It's really neat. We didn't show you, but the visualization, if you're coming in as a patient, you're going to be able to see your progress every week. We're going to be able to collect that data. And we have staff now that will do that data mining. And you're right, Vic. I think actually that is the nuts of our program is, and again, all age groups, right?
Hmm.
We're going to be able to see what works, who's doing it, what are the comorbidities, what are the risk factors. So I don't know. That is true. I'm very excited about that component
Yeah.
of it. And AI is going to allow us to do that. And Stuart and I have really spent a lot of time putting in the questions that we want. What do we want to know about that individual? While making it, patient friendly though, not so burdensome. But again, yes, the back end's going to have all that data.
Great. So one of the things I looked through your website and noticed that there's a lot of educational thing that you can sign up for, and I think that's a key thing that I found why I created UroNurse and then UroPatient is people don't know where to go, and they're going to YouTube to get information. Now, there's a lot of great information out there, like UroPatient and UroNurse, but there's a lot of bad information out there too, and not necessarily by anybody who knows what they're doing. I think that having a place to go to get good information and knowing that it's been looked at by experts and this is the proper way to just even Kegel exercises, we know they fail because people don't do them correctly.
No,
So
and
I
you're
think
right.
that
And there's so many gadgets out there, Vic. I always bring up Suzanne Summers. She had that Thigh Master, and I
oh
would have
yeah.
patients come in, and because she said, "Oh, this will help your pelvic floor," and I'm like, "No, it might help your thighs, but not necessarily your pelvic floor." But I'm inundated with ads on social media, on my computer, with all these devices. There's a place for some of these devices, and there's
Yeah.
some that have some really solid research, but the person needs to be guided and say, now what works for you. And you're right about doing Kegels. I always say, if I had problems, I probably would buy a device that I could use throughout, or maybe throughout your pregnancies, to keep that pelvic floor healthy. So they're going to be able to find that information with us and that direction from us, from really educated specialty providers who will be part of your urology health.
Yeah. So I do have a question I'm going to bring up here. So how does the platform personalize care for each patient?
You want to go through that, Stuart?
Yeah, sure, absolutely. So, obviously each patient is different. The way the platform is designed, it integrates digital health education and technology with provider-led care. So just like you would go to your primary care doctor, maybe your specialist, we provide the same type of, but geared around the medical care of urology, specifically for that patient. So you can
Yeah,
schedule an appointment, and that provider will do a full evaluation, of your past history, what you've tried in the past. It will have incredible analytics on your symptoms through our validated questionnaires that we're using, and to be able to develop a customized treatment program for each patient. In addition, then we offer the 12-week program, which is available for that patient to go through. But that provider being there to help guide that patient is really what makes us so unique, and
So,
really
so the
allows that
12-week
custom.
program, explain that a little better. What does that involve?
well, the
Yeah.
12-week program is each week is provides education on, like, one of the first things we have in, I think, week 2 is how does your bladder work? How does your pelvic floor work, so education around anatomy and physiology. Then we go around risk factors, and we spread it out over 12 weeks. And then we introduce bladder training of your urgency. But one thing for personalization is in the beginning, we ask the individual, what is your goal? What's bothering you? I think this is very important because the questionnaire may say, oh, I have urgency. I'm going to the bathroom every 2 hours. I'm leaking urine. But then when you ask the patient, well, what is your goal? It may be, well, I just want to be able to sleep through the night because I get up at night to pee. So we really tailor it to what is the individual's goal, and we track that. And then the provider can intercede and say, okay, now you said in the beginning that you wanted to do this. You wanted to maybe not have to be running to the bathroom. How are you handling that with bladder training and controlling urgency, and reinforces that. So in the front end, we do ask patients what really is their goal. I found so many times in practice what I thought the patient, like maybe I thought, wow, they're using 4 pads. I bet you they want to get rid of that incontinence. Whereas the patient would say to me, no, I just want to be able to work throughout the day and not always running to the bathroom.
Yep.
You know what I mean?
That healthcare bias.
Yes, right. So I'm like, wow, she wasn't so upset about wearing the pad, but she didn't want to be away from her desk or have to run out of a meeting.
Yeah.
So we try to meet the patient where they're at, and we do pick that up in the beginning. And then throughout, we can reorient them. Okay, this is what you said when you came into the program. How are you doing with that? Because the goals change. I can't tell you how many times a patient, like I'd see them in the 3rd visit, and they'd say, well, I'm still going to the bathroom a lot. And then I'd reorient them. But you were going every 2 hours before. Now you're not going as often. And I would say, now, look, you're telling me. So you really want to work with them as far as where they're at, what their goal is to get to, and then how to really get them to decrease those symptoms. So it's very personalized.
And the dashboard is so unique, and that really allows tremendous customization towards that patient. It allows us exactly what Diane was saying, because the goal may move. The what's bothering the patient now may be different than what's bothering the patient in 3 months from now. So using the objective dashboard, we can tell over time for each one of their symptoms how they're progressing. And so it may be urinary urgency is the big issue initially, but we can actually see using this dashboard that both patients and clinicians have access to, follow it, and it's such a fantastic tool to customize care for each individual patient. We may find over time, let's say, that urinary incontinence or urinary urgency significantly improves over time, but now nocturia is becoming their bothersome symptom. We can track each one of these symptoms very objectively using that dashboard.
And I want to say one more thing. I had a couple patients who developed incontinence during first pregnancy, and they were so worried about it's going to get worse if I have another baby. We're going to be able to work with that woman throughout that pregnancy. And I could not do that in practice. They couldn't come back in. My schedule was so booked. Do you know what I mean? But, they're so fearful of that. They may have gotten a little bit more control, but they know that the next pregnancy is going to be worse. So we can work with them. Okay. And the data shows that doing pelvic floor muscle exercise before and during is successful. So I think the personalization is really a key point of our model.
Yeah. I'm excited to see how this whole thing rolls out and works. One of the things I found, at least in my career, the most underutilized and probably most valuable tool for a urology practice is avoiding diary.
Yes.
Yeah.
I should say nobody gets them, but not enough people get those done. And you can get such valuable information because patients are reporting what's happening in their real life, not in, your artificial office or you're hooked up to a urodynamics machine. You really see what's going on. I think this is what you're going to start to really notice in all these questionnaires that you have and tracking patients for 12 weeks. You'll see these patterns and be able to correct them.
No, that's a good point. And that's why the data is so important. You're right. What are the patterns? And then what age group, right?
Yeah.
And what symptoms relate to that? So that, I don't know, I'm very, doing a lot of research in my career. I'm so excited about the fact that we're going to have that because it shows that these are conditions that people are not coming forward with. So we don't have a lot of understanding around that. And I think that's why, I really feel that's why we're going to be successful.
Yeah. It'd be interesting, male to female. We know that, a woman has a few drops or leaks, they ignore it. A man has 2 drops in his pants. He's in seeing the urologist. So
exactly right.
There's such a variance amongst all of us. So yeah, very good. Well, I'm excited. I think we're going to definitely have to have you come back in to
Be great.
give us a further update of where we're at, how we're going with this. I think this is going to be a great thing. We do have that link up there for folks that are interested in, sending this over, sending patients to have this as an option. We all know those patients out there that we don't have the time for. You guys are going to have the time to help treat them. Now, a little promo for next week's talk.
Elevated PSA, essential steps before ordering a prostate biopsy. An elevated PSA can be alarming, but it doesn't always mean prostate cancer. Before recommending a prostate biopsy, there are several important clinical steps that can improve diagnostic accuracy, reduce unnecessary procedures, and help patients make informed decisions. Join us on August 29th at 9 a.m. Central Time for this evidence-based discussion.
Yeah, that's going to be a good one next week. When I started urology, it's pretty much, and the PSA was developed right shortly after I was starting practice, it was PSA 4.0. Over that, you're going on for a biopsy, and it's changed. It's not the way it's done anymore. And so I thought it'd be a good time to discuss that. Well, Diane, any final words for us?
No, except that we probably are going to get into pre-screening for men with PSA and prostate cancer, because you're right. I don't know.
Yeah.
I don't know. You should do a talk on the fact that we're getting rid of the digital rectal exam, right? And
Yep.
I think this is going to worsen the whole problem, right? Oh my goodness, the PSA right away send to urology, and then they complain, well, we can't get into urology. So actually, pre-screening for prostate cancer is actually an area that I think will do well with telehealth.
Yeah. And Stuart, any final words?
Yeah, I couldn't agree more. I mean, Vic, thank you so much. This is really enjoyed. This is what a great show.
Yeah, thanks.
Really excited to hopefully come back and talk more about urology to your audience.
Absolutely. All right. We'll see everybody next week. Have a great weekend and enjoy life, and tune in to UroNurse every time you want to learn.